This video describes the arthroscopic repair and partial removal of meniscus tears. The meniscus is the structure that is seen between the two bones. When you look at it from the top, you can see that there are two menisci, medial and lateral. This shows a medial meniscus that is torn. There is an arthroscopic probe in place showing the tear. Unfortunately, this is not the type of meniscus that is easily repairable. In this situation, we have to remove the torn part of the meniscus so that the tear doesn't get larger and so that it stops causing pain. This is another type of meniscus tear that's even worse, where the section completely moves into the joint and displaces. This will pinch in between the two bones and sometimes cause the knee to completely lock. It is very painful. Unfortunately, again, the only option here is to remove the torn section of the meniscus. This can be done with a small device that's called a punch or a basket punch. This will remove the torn piece of the meniscus. Care is taken to remove only the injured part of the meniscus and to leave as much of the healthy meniscus in place. This is a small shaver device that is removing the torn meniscus and the loose debris from the joint once it's been eaten up by the small punch. Now we see the final meniscus after it's been treated. There is still some meniscus left, but everything is stable and will not cause pain any longer. In this situation, we're able to repair a torn meniscus. This is a specialized instrument that is placed arthroscopically. It has sutures on it that are placed across the torn meniscus. A knot is then tied down in order to secure the tear. In some situations, a meniscus is repairable. Unfortunately, this occurs only in about 10 or 15% of cases. Whenever possible, we try to repair the torn meniscus. This results in secure fixation of the torn meniscus after several of these sutures have been placed. This video clip will show a large rotator cuff tear that is fixed arthroscopically. This is the camera inside of the shoulder. To the right is a little grasper that is pulling on the torn rotator cuff. The bone to which the rotator cuff attaches is seen on the bottom right. That's the bone right there where the grasper is. We're viewing it from a slightly different angle now, and you can see the torn rotator cuff where it needs to be reattached to the bone, which is a tan-colored structure on the bottom. If you look underneath the rotator cuff, you can also see the ball and the socket part of the shoulder. The rotator cuff, once it's attached back to the bone, it helps to lift the arm up. This is a metallic anchor that is placed inside of the bone. This is a very small anchor that is less than 1/4 inch in size. It will go directly into the bone, and then it has sutures attached to it. The sutures are passed through the rotator cuff and then tied down. This is what reattaches the rotator cuff back to the bone. These are specialized knots that are placed with special instruments so that they can be all done arthroscopically. Once several of these anchors have been placed and the knots have been placed, the sutures are then brought out further to the side and secured with another anchor. This allows the sutures to bridge across the torn rotator cuff, as you can see here. This firmly reattaches the rotator cuff back to the bone. Now we just have to wait for the rotator cuff to heal. This process can take anywhere from 8 to 12 weeks for the rotator cuff to heal back to the bone. During this period, we have to be careful with mobility of the arm. Once it's healed, we can begin an aggressive strengthening program to restore strength in the muscles. This entire procedure is performed arthroscopically through several small incisions.